Yeah, good afternoon, good morning, good evening. For those outside the country, for those within, I'm greeting every one of us here. I still remain the admin of Medical Solution, both on WhatsApp group, Facebook, Instagram, Twitter, and here on YouTube channel. Many have been following me live and direct. Many have been following me up on Facebook, on the WhatsApp, and I'm here to treat a topic I captured fibroid and fallopian tube blockage and ejaculation. Now, for each and every one of us to understand more details about this issue, let me start from fallopian tube. Fallopian tube blockage. Many people, many women out there believe that they are perfectly okay. But I want to let you know, yes, you are okay, you are perfectly okay, but I want to let you know that fallopian tube does not often cause symptom. It doesn't cause symptom. Some people might be expecting maybe the ones they are having this kind of symptom, they will now know they have issue that related to the fallopian tube. Okay, no. Fallopian tube blockage occurs at any given time. So the same as sperm issue I treated on the last video. There is no specific single-handedly out that this is a particular issue that caused this problem of fallopian tube. Fallopian tube blockage is a very risky, it's a very dangerous case when it comes to infertility. Many people are hearing the English fallopian tube. Many people are hearing the whatever fallopian tube blockage. If you want to understand more, you just pay attention. I believe you grab much from this topic. Is well known, is well experienced for us to understand. Many women will try all possible best after 1 year, 2 years, 3 years, or for months to conceive, but yet they find it so difficult to conceive. After series of tests, after series of examination, they will find that they have a fallopian tube issue. It's either the left side or the right hand side is having issue. Most of the time, both of them are totally blocked. After teaching you this, you know more. Everything is all about medication. Yeah, you have to understand. You have to understand your system. You have to understand many things that you need to know about health. So that if anyone out there is telling you something wrongly, you'll be able to defend yourself, be able to defend that whichever he or she is trying to place you on. This fallopian tube area can lead to regular or irregular menstruation. It can never lead to regular. Sorry. We find it so difficult to understand this issue. Fallopian tube can lead to pain. Fallopian tube can lead to many areas, many processes that you yourself will be marveled. What is wrong with you? It comes in a different form. Some it will change their monthly cycle, some it will block, you will not see anything until you undergo some tests which is HSG. Well, someone was telling me, I've done it first, second, third, still, yeah, the thing is still blocking. Every time it's still blocking, every time. Some have gone to a place, some have removed one side, using one side of fallopian tube. But I am here to break it down to you that everything is all about removing the left or the right side of your fallopian tube. There are stages of medication you need to know, that you need to understand about this fallopian tube issue. There are conditions that lead to this fallopian tube issue on its own symptom. For example, there are things that you yourself as a human being need to know and you need to avoid. Those things that you need to know and you need to avoid will help you, will prevent you from getting into this issue of fallopian tube. First, number one, we call it infection. Some untreated infections, serious untreated infections. Many people embrace herbal medicine. Fine, it works for them. I'm not condemning any medication. But one thing you should know, you should first ask yourself the question, what or how is your body system reacting towards those things? That your friend took the same medication of herbal, it works for him or her, doesn't mean that your system and that of your friend's system are the same. It's very, very wrong. It's very, very bad. Some people are using their hand to reduce the natural active system they have, all because of some herbal drugs. Try as much as possible to know your system. Try as much as possible to know if you align with those medication or not. Some will tell you, okay, fine, since you're not ovulating, be taking this. Fine. This is a drug you used to be taking this. But you should know if your blood matches to extent of that medications. If your blood matches to those things you are taking, or you know that you are taking medication because of a friend is taking medication and the fallopian tube that is blocked is not being opened. My brother, my sister, is a very wrong thing. Advise your wife. We are as civilized, we should also know much about this issue about fallopian tube area. Endometriosis often cause very painful and heavy period and pelvis pain to increase the risk of fallopian tube. A period will flow from one day instead of from 1 to 4 or 5 days, it will flow 1 week, 2 weeks, 3 weeks. You keep on asking yourself what is going on. What is going on? That is exactly why I comment that every once in a while someone needs to upgrade his or her system. Check yourself often to avoid such thing increasing. Secret things that many women don't know about this. Some do take some pills. I keep lamenting on those pills people do take. Some do take prosmotul, some do take white spinning, some do take codeine, all kinds of things in order to prevent pregnancy. Some do take contraceptive pills. There are many of them that ladies do take in order not to get pregnant whenever they are meeting their man or whenever they after meeting their man after sexual intercourse. All those things reduce the active of your ovulation. All those things affect your chances of conception. Your friend might be taking it, but remember one thing you should know. Her system and your own are not the same. Even though both of them are the same, you should also understand something in this life, in this health. What is your group chat, your blood group? Sorry. What is your genotype? If it's the same thing with his or her own, is your white blood cells functioning? That's your question some people need to ask. Is your white blood cell the white blood cell that fight against disease and is it functioning? Is it in normal base? Is it normal range? Other videos I keep on saying, speaking in a medical terms, people still complain that I am blowing grammar. I want to bring it in a low class for us to understand. I don't want to start mentioning kinds of things that we all need to get confused on. In everything we do, we should try as much as possible to understand something. Fallopian tubes are usually blocked by scar tissues or pelvis. Those scar tissues, your question should be, where are they? Where have they been? Could it be accumulated infections? Could it be some certain things? These are some certain questions you need to ask yourself. Pelvis inflammatory disease. A disease can cause scarring. Some people will want to go to it, they'll tell you have PID. PID, that's pelvis inflammatory disease. Those things you are having, and you are going a wrong dimension in treating. After treating, you return back. You divert to herbal medicine. You divert to this. You divert to that. But yet, you have not gone to the right steps of medication, which will clear off those areas. Those things you are going through, the results are coming down to your fallopian tube area. The same thing I captured. Those fallopian tube is very sensitive in every woman. If your fallopian tube is not functioning well, there's no way you can conceive. If you're having an issue of fallopian tube blockage, it's also aligned with a topic called sperm leakage, what they call sperm leakage. Some people, after having sex with their husband or with their man, within 5 minutes or 20 minutes or even a day, the whole sperm will goes out. That's sperm leakage. The whole sperm will just, as they stood up from the bed trying to use the restroom, they'll just, everything will pour out. It's a sperm leakage. It's an error. Some people believe that the problem is from the man. No, it's not from the man. 90% are from women, while others are from men. Because of what? You, as a woman, you are suffering from the problem of PID. I thought about Doge. Doge simply means the way you wash your vagina, the way you clean your vagina, the way you. Some people use unmedicated soap. They will wash it and do all those things cannot help you. Rather, it will create more problems that you might spend 200,000 naira or $5,000 or sorry or five or $2,000 or 120 Ghana cedis. These are things we all need to know, we all need to understand. And I started finding it so interested that mostly people from Ghana, they are the ones that, sorry to specify a country, but they are the ones that are more in this area of fallopian tube. Nigeria also included, but from my own side of record, many are from Ghanaian, and it's very, very irritating. There are many gynecologists, there are professors in Ghana. In Ghana, they can do more than I do, but the issue there is that there are stages, there are steps of medication you need to undergo, which will also help every one of us. The same apply when you talk about fibroid. The same apply when you talk about hormonal imbalance. The same apply when you talk about ejaculation, sperm, ovarian cysts, irregular menstruation, inactive of ovulation. These are the things we need to know. We need to put hands together and correct perfectly. Fallopian tubes are mainly caused by infertility. Sperm and egg meet. It's a simple something that everyone can just write. What is fallopian tube? If you don't want to prolong long English, because some people are complaining English, fine. It's a simply known as sperm and egg meeting in a fallopian tube for fertilization. But once it's blocked, once the place is totally blocked, there is no way it will pass through to meet. A door that is closed, you can't break it. You must look for a solution, a key to open it, for you to open, then for ease you to enter, for your easy entry. A fallopian tube are commonly caused by infertility sperm and egg meat. Simple. You ask about another one, they said other one comes to a fallopian tube prevents them from joining. Like I said before, prevent them from joining. When it's blocked, it can't go in. It's either you call it from sperm going out on its own. When a woman is having a problem that has to do with infertility, mainly that has to do with a problem called sperm leakage. When the infection has already accumulated in you, and when a man deposits, the rate of the infection in you will subdue the sperm down and neutralize it to just flush like a water. They have watery sperm. Yeah, I'm coming on that area. They have sperm leakage. They have a low sperm count. Those things has different definitions. You might define it on your own way. The other person might define on his or her own way. That is most of the times people talk about IVF on the process of this fallopian tube area. There are secrets about IVF some people don't know. Everybody said it's 50-50. Yes, you also believe it's 50-50. But there's some treatment you need to undergo for you being a woman to also have a result of this infertility, of this fallopian tube, of this issue, of this IVF. IVF is being done successfully if you undergo a test of medication. I'm not talking about the one that you're going there. People that are testifying through my group or even through the channel, even through Facebook, already know. People undergoing treatment already know. You can't just stand up and say you are going for IVF. Fine, you will go, it will work successfully, but believe me that 1 month, 2 months, 3 months, if we have 60 that performs IVF, believe me that 3 are successful, others failed. If you get back, it's 50-50. It's already written, it's very sign. You can't do anything. It's very known, and everybody should be very, very aware. There are medications you need to know about when you talk about IVF. Some people have gone through first, second, third, still is failing them. Your question should be, what is happening? If you want to know, come close. I will whisper to you the main thing that leads to those areas. If the sperm is not moving through the passageway of fallopian tube, there is no way conception will occur. And you also talk about ectopic pregnancy. You talk this. I will also talk about ectopic pregnancy. This is when I will talk about on the next video. There are eggs that requires for IVF. I thought about that on my WhatsApp. Yeah, there are eggs that requires an IVF. There are ones that is not even needed on the IVF. Some people are so dormant, some people are so stubborn to believe the fact there is an error when it comes to some areas. Some transmitted infection diseases risk sexual transmitted by all these unsafe sex, unprotected sex, all this, all that. Yeah, it's very nice and very good, but the repercussion is around the corner. Listing very good. I just want to end here and also summarize everything. First, the kind of medication you take in order to abort a baby, in order to induce, in order to commit abortion, the kind of English you might use, it's fine. during your youthful time, during your whatever, believe me that it's affecting you. Some will take Prosmo 2 in a space of 1 year, 6. You ask yourself, are you normal? Start to take. Some people are not using it as a PCM. They take it as anytime they are giving it's never a problem. They're taking it as vitamin C syrup or vitamin C tablet. They're taking it, they don't even care. A girl will take what they call codeine and miss it and use codeine to take a white quinine. I was like, are you a human being? It's very, very wrong. Whereas some people are very okay, naturally okay, they didn't try they didn't try anything, yet they are suffering this issue of infertility. The question should be, what about your opposite sex? What about your husband? Try as much as possible to follow up. If you want to get more, subscribe and also like, share, and comment. Ask your questions. I'm free to answer you in any time, any moment. But you, whatever you are doing in this world, try to observe something that will help you later and now. Fallopian tube is a risk when you move on to a problem that has to do with infertility. It's very bad and it's very okay for those that will neglect. When the two fallopian tubes are totally blocked and you try to open it, when you run to a text, say HSG, you go this, you do this, but yet nothing. You will convert to IVF. And the process of the IVF, it still fails you. You should ask, there is something, there is an error. That error is what I'm taking some people on my WhatsApp group, on my Facebook, to tell them the reason why those things are failing and what they're supposed to do. You can't start having a problem of headache. You're feeling headache and you're taking suspension for ulcer kit. It doesn't work. Last video I showed you a picture. I showed you a drugs. That drugs is very, very mine. But I cannot give any of my patients that drugs, even those in outside country and even those within, because I do send drugs across the country, even within the state, even within the country. I can't send those drugs, only other one, because I need to start from the foundation, from the roots of the problem. The last medication will be that one particular one I showed on the last video, which will also help you and also help you to fasten your conception, for you to smile. It's not by magic. It's never by magic. It's just by understanding and following the steps of medication. Thank you. See you by this time on Monday. I love you all. I still remain Dr. Kevin Ifani Chuku, a gynecologist, a group admin of WhatsApp, Medical Solution, and also on Twitter, Instagram, and Facebook. Try as much as possible to follow up. You will learn more and you use your Bible to write and ask yourself questions, and feel free to ask me questions. I'm ready to answer you. Thank you very much. I really appreciate